Good afternoon, everyone, and welcome to our welfare question and answer session this afternoon for our 2021 National Conference Cardiomyopathy UK. I'm joined today by some excellent speakers. We have Dr. Ian McPherson, who is a psychologist, and he's also one of our trustees. We have Tootie with us as well. So Tootie's got many, you've got quite a few titles, haven't you, Tootie? Perhaps you can kind of give those as we go forward. So Tootie's here to look at any clinical welfare aspects of concern that you might have. And we also have Osian Evans, who's one of our support group leaders. He's also a social worker, and he has a lot of experience in benefits and welfare rights. So what we thought we'd do is I will put the questions to our panel that we've received throughout the day. So thank you for all the questions that we have received. The first one I think will probably be for you, Tootie. So one of our service users has put, I've been lucky enough not to have contracted COVID, but the biggest impact on me has been a loss of fitness. I found it really hard to motivate myself to do other forms of exercise, and I've put on a significant amount of weight. I'm worried about how this will affect the cardiomyopathy.
Yeah, so just to say my background is also that I'm a inherited cardiac conditions nurse, and also now part of the Southeast Genomic Medicine Service Alliance. So the sort of my I think the most significant titles that applicable to here, and also I'm a trustee of Cardiomyopathy UK. So I think that there is a lot of there is quite a concern for a lot of people actually is putting on that extra weight and losing that fitness during lockdown because of lack of motivation and inability to go outside. I think particularly in terms of affecting the cardiomyopathy, I guess the more weight you're carrying, it's just the more sort of effort for the heart rate to keep you going. But it's, I think a little bit of weight gain is not impossible to shift now that we're able to go outside more. I think it's best to start with something that's very sort of practical and not so sort of easy to access, like walking and being with, trying to partner up, buddy up with somebody to try and do things that are exercises that you like to do, and to start gently and build up your fitness. I think it's not so much about fixating on the weight, but really getting back into fitness, because then as you're able to move more and feel more comfortable moving, then I think that will be, I think, the way to go forward. And then, hopefully you'll build up and the weight will come off. But we also have to focus on a very good diet as well, because it's very difficult. They say you can't outrun a bad diet, and actually that's quite true. So you need to work on both, but not drastically, I think. So having a good diet, and coupling that with exercise that's to start off with, gentle to moderate, I think can start you off. But also buddying up, I think, with somebody is also something to keep you motivated.
Thank you, Tootie. I think the next question is probably best put to Ian. Ian, one of our attendees has said, I feel that COVID has made me more anxious than I used to be, and this makes me worried that I'm putting my heart under more strain, as well as the people around me. How can I reset my thinking and go back to the way things were?
I think that's a very understandable concern that a lot of people will probably identify with. I think all of us with COVID have had to work out how going into different environments is likely to do things, and it's not been helpful that a lot of people are no longer wearing masks. So that in itself was a definite benefit, and hopefully people might return to that when they realise how valuable that is. If you're feeling very anxious, I think it's time to try and just say, well, let's face it. And it's not unlike what Tootie said in relation to the exercise. It's actually, don't try and force ourselves to go into situations which we can predict will be very difficult, but maybe building up and thinking of places that we would feel comfortable, and maybe where we won't expect there to be too many people, and whether there'll be good ventilation, which is another important element for this. And also being able, and it depends obviously on our circumstances, but to find somebody we can talk it over with. There's also an echo with what Tootie said, and if there is somebody else who makes us feel comfortable and we know understands us, and that could be a member of your family, a friend, who you can go with, and just go along, and they can be there, their support, their reassurance. But also, if you're not feeling so good, and you just say, look, I'm not feeling up to this, just say, okay, we'll go. And then gradually build up time. But I think it's sometimes, again, we think, is anxiety going to put too much pressure on our heart? Well, any stress puts pressure on all aspects of ourselves, but it's not going to make a huge difference, to be honest. And I think sometimes we can understandably find ourselves overthinking things and getting very anxious. Whereas if we just say, well, no, this isn't going to be too difficult, and I can do this, but make it easy for yourself at first, and don't try and put too much on. The psychological pressure, there is an interaction between physical and psychological, but it's very, very unlikely that psychological pressure is doing any damage to your heart. And actually being able to get out and socialize is in a way that works for you is, I think, the best thing you can do. But don't beat yourself up because it's difficult at first. It's difficult for all of us.
Thank you, Ian. Ian, staying with you, another question that I think is probably best addressed to you. So one of our attendees says, since the pandemic, my adult children have become more worried about me, and they try to influence my decisions about what I do. I want to be able to explain to them that I am being cautious, but I do need to live my life. What would you suggest?
Oh, yes, I think a lot of people will have experienced that. It's lovely that our family worries about us or is concerned about us, but sometimes it can actually be a little bit intrusive. And obviously, talking to them and trying to do it is a good thing to do. It may also be very good, however, for them to help them find material about your specific condition and about why it is very important that you remain in control of what you do. You are the expert in you. And much though they care about you, your family aren't. And I think if maybe you can look at some of the material that's on the Cardiomyopathy UK website, look at things that refer to the areas of your life that are important and maybe they're more worried about, share that with them, try and have a discussion with them, because it's natural for families to worry, but sometimes that worrying actually gets in the way. So I think take a strong but sympathetic line to them, and also think, well, you know, if you were giving them lots of advice about their lifestyles, how would they react to it? It's not the best way to bring about change. Encourage them to think about it, read some stuff, and actually it may be good for them to look at some of the material that they see other people doing. So looking at, if you use the Facebook group, to be able to see the sorts of things, because there's a lot of very helpful common sense support on there, and a lot of people coming together who actually are living with the condition as you are. So nice that they're concerned about you, but allow yourself to remain in control.
Thank you, Ian. Tootie, I think this one's for you. Somebody else has said, I've been worried about going to hospital for regular appointments because of the risks due to COVID. I've put things off and now I feel like it's too much and I might be making my health worse. How can I get over this fear and get back into my normal routine?
Yeah, I think there is a fear for lots of people to go into hospitals because of obviously the COVID patients are there. But one thing to remember is that, you know, that there's all the precautions are being taken in hospital, social distancing, masks, and all the hand washing. I mean, they're more conscientious more than in any other place. And when they set up your appointments, that it's set up so it's timed so that there's very fewer people in the clinic. There's actually a lot of space within the clinic rooms, and all the tests that you're going to have, you know, there's provisions to make sure that there's not a lot of crowding, and there's lots of ventilation. And also hospital personnel are tested regularly as well. So I think that's quite reassuring from that sort of contact point of view. But also I think even so, with that in mind, there's still that barrier of, you know, the risk, because, you know, there is an extra risk to going out. But I think overall, if you haven't been seen for a long time, or you're having signs and symptoms and really need to, your clinical team need to look at your health status, it's really important to attend and take that step, because you will be more reassured when you've been fully assessed, and you can have a good conversation with people, and that will probably be more reassuring to you, and there will be less worry in the long run when you've got that full report on your health.
Okay. And the next question is, I'll probably take this one. I have applied for PIP, so that's personal independence payment, twice now, and every time I've been rejected. Why is this? Okay, so I think one of the difficulties that we see, that the charity sees quite often, is people being rejected on their PIP application. It's not something specific to cardiomyopathy. I have colleagues in other third sector organisations who work with people with long-term conditions and acute conditions, and they tell a very similar story. One of the things that we do suggest here at the charity is that one of the best ways that you can kind of make your case to get PIP is on the application form. So there are certain sections within that application form that allow you to give additional, they call it additional information, but the charity can show you how to actually articulate what your life is like living with cardiomyopathy. We have to remember that there's sometimes people think that when they have a medical assessment, whether it's over the phone for PIP or whether it's face-to-face, that these will be doctors or these will be people with cardiac knowledge. Unfortunately, that's not always the case. So Dwp Clinical Assessors, so people who will assess your fitness and suitability for PIP, they could be physiotherapists, they could be paramedics, and that's not to decry those professions or those people who do those professions. It's simply to say that they might not have the requisite cardiac knowledge about cardiomyopathy to make the decision that perhaps should be made. So one of the things that we always say at the charity is that we can help you, particularly to challenge PIP when it's been refused. So whether that's what they call the first tier, which is a mandatory reconsideration, and the second tier, which is the tribunal. So we can actually help you to articulate exactly what your cardiomyopathy is like for you. I do see a lot of people saying, oh, just tell them about your worst day. That's kind of not always helpful, because a lot of DWP assessors are trained to spot the this is your worst day, and that doesn't do you any favors in the long term. So what I would suggest to this person is get in touch with me or any member of our services team, and we can have a look at your application, have a look at the reasons why you were refused or awarded low points, and look at how we can challenge that. And if it's gone slightly out of the deadline, if we can't get an extension, then we can help you rewrite or resubmit that application. So there's always hope. But I would say, just to kind of close this off, do try with PIP. And if you are watching this and you have unfortunately been rejected, you know, don't sit on it. Get in contact with the charity Monday morning, Tuesday morning, and let's look at this and see what we can do. Because I would encourage you, you know, if you are unwell and you know you need PIP, then we can certainly help you get that. So please don't try not to be put off. We can help you. So the next question that I have is, I think this one is for you, Osian, if you can answer. This is about the blue badge. So an assessment for a blue badge that I had resulted in me having 12 hours of atrial fibrillation. Now, I'm aware you're not a clinician, Osian, but you do have the condition, so you will have an understanding of a rudimentary understanding of AF. But the question is, even though the assessment in of itself caused 12 hours of AF thereafter, I was still refused this blue badge. So is there any advice as to what I could do to get this badge?
Yeah, with blue badge, it's if you can demonstrate that you're virtually unable to walk. I believe so. It's 50 meters. So check what the criteria are beforehand to check that you fit the criteria. To explain then, and then also back it up with medical evidence. Yeah, that's what I'd advise. Also, if you're on PIP and you're on the highest rate of PIP, you automatically get a blue badge. So quite possibly, if you believe that you need a blue badge because you can't walk to your car or reach it, I'd go back to Ali's previous answer and get advice about your eligibility for PIP. Because usually people who need a blue badge because of things like breathlessness, which comes from atrial fibrillation, or the fatigue, it's because their mobility is limited. But of course, for older people who do not qualify for PIP, it's again kind of back up your claim with medical evidence. Explain to your clinicians about your limitations in walking and everything. And if they note it down in your report that your atrial fibrillation limits your function in walking and breathlessness, that would then back up and evidence your claim. So I'd advise someone to seek medical evidence to then strengthen your case, and then help the assessor then kind of appreciate the reasoning why you need the blue badge. But before making the claim, check for the criteria, if you fit the criteria, because sometimes people might, because of a diagnosis and their difficulties, might claim for something and then they do not kind of fit the criteria, unfortunately, marginally in some cases.
Thanks,
That
Osian.
helps.
Yeah, thank you, Osian. Just on the back of that, when Osian's talking there about looking at eligibility criteria, so if there's any of you out there who are thinking about a blue badge, then pop onto the Citizens Advice website, just put in CAB or Citizens Advice Bureau into your into your search engine, or bar at the top, a search bar, and you'll come up with it. And one thing that I would just say as well, just to round that off, Osian, is it's sometimes having to have conversations with people who are awarding, whether it's the DWP awarding PIP or it's the council awarding a blue badge, about what cardiomyopathy is, because the charity finds that when applicants apply for a blue badge or PIP or any kind of benefit, when they actually explain what cardiomyopathy is, that tends to have more of a positive impact, because I think sometimes we assume, because we're in the world of cardiomyopathy, that lots of people know what cardiomyopathy is. So, and we've had kind of misnomers where people have said, oh, well, I've had a heart attack as well and I didn't get a blue badge. And it's like, yeah, but it's not a heart attack. So it's about actually articulating to the assessor or to the council, to whoever you're applying to, what cardiomyopathy is and how it affects you. So that's a really good point as well to remember. Thanks, Osian. I think the next one is for you as well, Osian. This is about work. So unfortunately, somebody says, work have been really unsupportive. I was diagnosed with hypertrophic cardiomyopathy a few weeks ago, and the GP advised a slow phased return whilst I undergo the additional tests requested by my consultant cardiologist. Work would not support this, so I have now been signed off. How do I deal with this? They've also refused an occupational health referral.
This is relating to the Equality Act, with regards to an employer's responsibility to make reasonable adjustments, due to a chronic illness that affects someone. So I would, in this case, kind of, if the person is in a union, consult their union reps with regards to negotiating their things. If they're not, join an union and then soon after seek the advice. Otherwise, there's ACAS, there's advisory organisations where you can discuss the situation. They will then advise on your rights under the Equality Act with regards to the adjustments. They've got to, justify why they wouldn't or wouldn't consider, making reasonable adjustments to enable you to continue with work safely, phase returns. With regards to occupational health, if they've got an occupational health officer there, look at advice from the ACAS and then from citizens advice as well. But they should, if there's a chronic illness restricting your ability to work, there are reasonable adjustments. There's things such as access to work as well, which, if you've got health problems that, you need extra, funding for equipment or anything, which can help and everything with IT seats and everything, that you can pay for these adjustments. So if your employer's worried about additional costs, there is help from government with regards to that. ACAS, citizens advice and everything can help you with, accessing these services. But with regards to any grievances of problems, I'd go to ACAS, which is a government, independent kind of organisation giving advice.
Thanks, Osian. We also incidentally have a fact sheet on the Cardiomyopathy UK website all about the Equality Act. So it might be useful as well to just have a little look at that, so it gives a little bit more on what Osian was saying there, just to kind of, and so you have it in front of you, so you don't have to kind of think back to what Osian said. Thank you, that's really helpful. Tootie, this question I think is probably best for you. Despite being diagnosed with dilated cardiomyopathy, I only ever hear the term heart failure in my treatment. Should I ever expect otherwise?
I think what heart failure is sort of the outcome, or this what your signs and symptoms are kind of making up, as heart failure. But the cause of your heart failure is probably the dilated cardiomyopathy. So it's important to and then of course, is that dilated cardiomyopathy inherited, or because if you don't have that within your sort of narrative in the condition, I think it's harder then to really offer you the full range of all the things that you need to either A, get the treatment, and B, what is the source of that, and therefore to tailor that treatment. I mean, some treatments for cardiomyopathy will be quite generic in response to heart failure, but there are certain, but knowing the type of cardiomyopathy you have also directs things, that family care and other aspects of the care that's important. So I think it should always be coupled in that narrative or in your clinic letter, so that there's that added dimension and the added aspect of the dilated cardiomyopathy can be seen too. So I would say make sure it's always taken into account.
Thank you, Tootie. That's really helpful. Ian, I have a question here. So somebody said that I've been really, really struggling with COVID-19 to the point now that I'm unable to leave the house. My doctor I've spoken to on the phone thinks I need a referral to psychiatry. What do you think this will mean in the long term, and will this impact my cardiomyopathy?
I think it's understandable that for some of us, having the concerns about COVID can really impact on us. It's interesting that your doctors mentioned a referral to psychiatry. That could be what you need, and if that's what the doctor thinks you need, that would be fine. There are other things that your GP could refer you to, or actually you can refer yourself to, which, because psychiatry and secondary mental health services tend to deal with the most complex mental health problems. there is a service called Improving Access to Psychological Therapies, which is available, and it's intended specifically for people whose problems might not quite make the secondary mental health services criteria, and it's available, and your doctor can refer, or you can refer yourself, and there you would be assessed by somebody with appropriate training in counselling and or psychological therapies, and they could work with you to look at the sources of your anxiety and look at strategies for coping that would gradually allow you to move out of the house, think about being able to move out of the house in a way that works for you. So obviously this will be slightly different in different areas, but if you want a bit more background, there's information about improving access to psychological services, sometimes called IAC, and that is on the Cardiomyopathy UK website. And if you had difficulty locating that, I'm sure Alison's colleagues would be very happy to find and direct you to that, because I certainly know people who've had quite severe anxiety that's impacted on their life, who've got cardiomyopathy and who have gone to those services and found they're more easy to access, in the sense that you don't go onto a long waiting list. You're much more likely to be seen within a reasonable time and get something that is very much focused on you. Whereas sometimes trying to access specialist mental health services, there can be long waiting lists, and that they may not be, well, they can offer very similar services, but it may be more difficult to get to. And it sounds as if it would be good if you could talk this over with somebody with the right background fairly soon.
Thank you, Ian. Tootie, this one's for you. I'm having difficulty at the moment with my cardiomyopathy, the treatment for my cardiomyopathy. It's almost as if my GP, who I really like, and my cardiologist, who I really like, don't seem to communicate. This has resulted in lost test results and confusion over the dosage of medication. How can I get these two people to speak?
Gosh, I'd like to say that this is a rare problem, but actually it is quite common. I'm sorry to hear that this is happening to you, because this puts you quite a lot of risk and doesn't, it takes longer to optimize your treatments. I think it's really really need to be proactive in, I think, keeping copies of your letters from your consultant and making sure you get electronic or paper copies of this, because then it might be that's the case that you bring it to your GP to then be able to make sure that he's got the most updated information. The other resources, obviously, if you've got a specialist nurse, either a heart failure nurse or an inherited cardiac conditions nurse who can help coordinate your care, usually they're also very helpful because they're easier to contact and they can send information to your GP very quickly. Whereas the consultant there might be a bit of delay to that. So hopefully there are some areas with systems where the GP and the consultants can access the same sort of records now, and that's coming through to the NHS. But unfortunately, that's not everywhere. But I think making sure that there's a clear sort of plan of care for you is really vital to making sure you get the best care possible. And I think at this point, it looks like being proactive in having those copies of letters and sharing them with your GP is probably the first practical step forward at the moment. And hopefully things will get better as systems within the NHS also get better.
Thank you, Tootie. Osian, this one's for you. So somebody asks, could you tell me what the eligibility criteria is to claim carers allowance? My husband has cardiomyopathy.
Okay, to claim carers allowance, the husband, the person who's cared for, needs to be in receipt of the daily living element of PIP, or attendance allowance at the lower or higher rate, or for a child who's on middle or higher rate, care of disability living allowance. So depending on the age of the husband, if he's had the condition for 3 months and likely to have functional difficulties, are therefore qualifies for the daily living element of PIP. Doesn't need to qualify for the mobility element, but needs to qualify for the daily living element of PIP. Or if they're pension age, it's attendance allowance. So husband has to be in receipt of those benefits, and then the person caring then has should not be working, earning less than a set amount. It was £100, it might have changed, and then also not in full-time education. So there are criteria afterwards, even if they're caring for a person on personal independence payment or attendance allowance. So there are also criteria. Again, Citizens Advice or .gov website, or the good people at Cardiomyopathy UK helpline will elaborate further.
Thanks, Osian. Thank you. Ian, this one's probably for you. So somebody's put, how can I tell what is anxiety and what is my cardiomyopathy? COVID-19 has made me extremely anxious, and I missed my last consultant appointment. So now I'm worried whether the fast pacing of my heart and the sweating is from my anxiety or my cardiomyopathy. Is there any way to tell which?
In reality, anxiety and heart condition, these symptoms overlap. And of course, they can interact, so one adds to the other. What I would suggest that when you've got physical symptoms that could be due to your heart condition, then it is very important to get those checked. I think the fact that you're aware that you have anxiety and that anxiety can produce similar symptoms is good, but it's always better to get that checked. And again, depending on where you are with your health, I think if you can have that conversation or arrange to be assessed, it may be initially by your GP. If it is anxiety, the GP may be able to recommend things that would help deal with the anxiety symptoms. But it's very important that you emphasize that these symptoms, which could be related to your heart, are checked and looked at. And I would encourage you very strongly to seek support from that. But probably, unless you've got a good link currently with your cardiac team, and if you have, and as Tootie was saying, if you have access to one of the specialist nurses there who you could speak to initially, perhaps over the phone, or try and get an initial assessment by your GP with the possibility of being referred on to the cardiology team if that's necessary. But important not to just leave these, because none of us who have got the condition know and can tell whether the symptoms are coming from one thing or another. That's why we need specialist support. And I think it is very important to clarify that. And you'll be told, oh, well, it's anxiety, which is perfectly understandable. You don't need to be worried about your heart, but that in itself will reduce the anxiety. So good to get it checked out and get support as soon as possible.
Thanks, Ian. So I'll probably take the next one. So somebody's put, during COVID, I was shielding and had to work from home. I put on a lot of weight, and this has really affected my mental health. I can't help but thinking I'm just going backwards and things aren't going to get better anymore. I feel really low. Who can I talk to about this that will understand from my perspective? Well, we have a number of community peer support volunteers. So if you are feeling quite low and you feel like you're kind of sliding backwards, as you've put, then it might be useful for you to kind of, you can email myself or any of my colleagues at the charity and ask to speak to one of our community peer support volunteers, and you can do that over the phone in confidence, and we will match you with somebody who has had lived experience and has the condition, and who you can kind of talk to in a safe space and have that kind of supportive listening ear. If you wanted to, you might want to join one of our online support groups. if you don't feel ready to kind of go to a physical group, or if you don't want to be visible online, then you can certainly come to one of the groups and observe, or the same with our coffee and catch-up sessions, which happen every Friday at 2 p.m. So, I mean, please don't feel that you are on your own. There are plenty of community peer support volunteers here at the charity who are highly trained, highly empathetic individuals, many with the condition themselves and all with a strong connection to the condition. And just like yourself, we've had our volunteers and of course the staff as well. COVID-19 has been difficult for all of us in different ways, and sometimes we felt quite low, or as you've said, like we're sliding backwards. So you're not at all abnormal or on your own at all. So please, if you want to kind of get some support from us, we would love to hear from you, and we'd love to be able to provide that kind of one-to-one support, or however you want to receive your support. So please do email me or any of my colleagues at the charity. The next one, I'm going to probably open this up to Osian with a bit of support from Tootie, because it's quite a complex one. So it's about the DVLA and driving. So what does the DVLA mean by incapacity? For example, what's the difference? This is what I've called you in here, Tootie, as our super clinician. What's the difference between ICD implanted for sustained ventricular arrhythmia associated with incapacity and an ICD implanted for sustained ventricular arrhythmia not associated with incapacity?
Do you want me to just differentiate between the two first? So the one that says implanted due to arrhythmias due to incapacity, this is where you've probably already had a cardiac arrest and had either fainted or required resuscitation, and that is when you were given an ICD as secondary prevention for an event that's already happened and caused sort of a serious sort of a consequence where you were unable to control a vehicle or something, if that were the case when you were in a vehicle. The second criteria, which is ICD due to implanted due to an arrhythmia without incapacity. Now that is just you've had the symptoms and it's more, you've already got the condition, but it's more preventative. So you haven't actually had that event yet. So I think so the latter one is probably where you're going to find there are probably more restrictions. Not the latter, sorry, the former one is where will get more restrictions. The one where it says implanted due to arrhythmia with incapacity. That's the more you get the more restricted rules there.
There is a on the .gov website, there is actually kind of a specific part under the DVLA referring to incapacity to drive and arrhythmias. It goes through a lot of what Tootie says and everything like that. With regards to the law and driving DVLA, it's your responsibility to be aware of your capacity to drive. Even kind of, if it's one-off and you feel dizzy, starting with a new medication as well. If you doubt in any way your ability to drive, you shouldn't drive. And then with regard to arrhythmia, there is a list of, with angina. There's a section on the .gov website about cardiovascular disease and the DVLA. I would advise anyone to refer to that, or through the Cardiomyopathy UK helpline, they can help guide you with that website and what the rules are with regards to driving. But generally, if it does affect your ability to drive and if it's those criteria, you've got to inform the DVLA because it can void your insurance and everything.
Thank you, Osian. Thank you, Tootie. The next question, probably for Ian. Ian, I have been diagnosed with hypertrophic cardiomyopathy for 6 months, and I'm constantly stuck thinking that every time I go to sleep, I won't wake up. How can I stop thinking about this? How can I switch my brain off?
And a very understandable worry, but one that is actually not a real problem. If you've been diagnosed, you will almost certainly have been advised to take certain types of medication, which will be helping you. So in other words, we are much more at risk when we haven't had a diagnosis. If we have a diagnosis, we are being monitored. Excuse me. We will have a started medication. I think when we go to sleep, very often, many of us will find that's when the time when whatever the worries are we have sort of crowd into our head and get out of proportion a little bit. And it's understandable, but sometimes it's about using time outside of when we're trying to sleep to just actually get ourselves comfortable with the idea that we have got a condition that is not great to have, but actually, as we've got lots of people on here who have are living very good lives with it. So it might be that it's useful to talk through with somebody who understands a bit more about the condition, and particularly somebody who remembers what it was like when you first get that diagnosis. And I wonder if this might be an opportunity for you, if you haven't got somebody close to you who you would feel comfortable talking to. This might be an opportunity to talk to one of the peer volunteers that Ali has mentioned. And if you contact Ali and her colleagues, I'm sure they would be able to find somebody who's been in a very similar position. It's very common when we first get the diagnosis that we get really anxious. It's not something that very often we think we ought to just be able to switch it off. And well, I think all of us would like to be able to switch these things off, but that's really hard. And I think the more we get comfortable in our own minds that we have a condition, but we're getting treatment, we will get that monitored. But talking to somebody who's been there, somebody who's had to cope with that, can make a huge difference. So if you haven't got somebody you can do that with at the moment comfortably, then I strongly suggest talking to one of our peer volunteers. And I think you would find that very helpful.
Thank you. We've only literally got about 4 minutes left now. There are a couple of questions still left over, but due to the nature of those questions, I think it's probably better if we answer those individually and privately to give you your privacy rather than kind of share them on here. So we will be doing that within the next week. Thank you so much to our fantastic panel. I must apologise profusely for having a complete mind blank when I got to you, Tootie, so please forgive me. I just completely blank, so I apologise for that. But thank you so much for all of your questions. Please remember that the charity is here. That helpline is open Monday to Friday. You can always, the Facebook closed group is open day and night with lots of our peer supporters and our fantastic admin team and lots of people with lived experience. So please know that you're not alone, and we truly mean that. You're not alone, and we will help you in any way that we can. And like I said, any of the questions that are perhaps a little bit private, we will be answering those. So please be assured that your questions will be answered. So thank you for joining us this afternoon, and we hope you've had as enjoyable a conference as we have. And thank you to my colleagues and to you as well watching. Thank you.